So today we're just going to be taking out a tooth on your upper left side. Does that sound correct?
Yes.
Okay, great. So we're just going to go ahead and get you all numb, and then the doctor will get started with that procedure. Do you have any questions for me?
No.
No? Okay, great. So now that we're done with the procedure, I'm just going to explain to you some aftercare for this. Okay. I can't even get through the first two. How am I going to do this?
That's why I wanted you to practice
I know,
and go through
but I wrote it
with
down and
mistakes.
I tried. Okay.
Well, it's different when you're talking.
Okay. Okay, so today we're going to be taking out a tooth on your upper left side of your mouth. The doctor's just going to go ahead and get you numb and then go ahead and get started with that procedure. Do you have any questions for me?
No.
Okay, great. So now that we're done with the procedure, I'm going to explain to my patient some post-op instructions. So the first thing I want to talk to you about is numbness. You're going to be numb for the next 2 to 4 hours. So just be careful while you're numb not to bite your tongue, cheek or lips. And the next thing that you might experience is some swelling. It's normal to have swelling in that area, but just make sure that you are putting some cold packs on it for the first 24 hours. You can do 20 on and 20 off, and then the next day you can move to heat packs and do the same thing, 20 on and 20 off. And the next thing I want to talk to you about is your diet. So just stick to very soft foods, things like ice cream, pudding, jello, nothing too hard or crunchy. The next day you can move into more harder foods, just depending on what you're comfortable with, things like sandwiches or breads or things like that. Just stay away from any nuts, seeds, or anything small like that that could get stuck in your mouth. And then the next thing I want to talk to you about is bleeding. Bleeding is normal. You might have some blood-colored saliva or even some discharge coming from the area. That's normal for the first couple of hours, but just make sure that if you have any bleeding that goes beyond that couple of hours, that you go ahead and contact the office. And you're just going to want to make sure that if you are experiencing any of that in the beginning, that you're taking some gauze and keeping that area pressure on that area so that it stops the bleeding. And you want to keep those on for at least the next 30 minutes. And as far as the surgical site care, you just want to make sure that you're very careful not to disturb the area. Make sure that you brush your teeth normally and everything and floss, but just try to really be gentle with that area and stay away from it. Don't swish your mouth vigorously. Don't use any strong mouthwashes or anything like that for the first day. And then we did go ahead and place some sutures in there, so you just want to make sure that those stay in for the first 48 hours. If you notice anything coming out, go ahead and contact the office because they should stay in there. Otherwise, they should dissolve on their own. And then again, just with oral hygiene, just make sure that you're keeping your mouth very clean, making sure that there's no food in the area, just doing your normal hygiene routine, while still trying to be careful of the area. And then you want to make sure that you're not doing any strenuous activities for the first day. Absolutely no smoking. And then you might be experiencing some pain, and you can go ahead and take ibuprofen or Tylenol for that. You might have a fever. This should be no more than 100.5. If it goes above that, go ahead and contact the office. And then there's something also you can get that's called dry socket, which is when the blood clot is dislodged from the surgical area. And this can be very painful, and you need medication to fix this. So go ahead and give the office a call if you feel like this has happened to you. And then as far as anything else, do you have any other questions?
I do not.
Okay, great. And then I'm just going to finish with detailed progress notes. Thank you.